Hello, I'm Dr. Arlen Ford, the chairman and founder of Activator Methods International. And I'm very happy this morning to have our guest, Dr. Deb Bushway, who is the president of Northwestern Health Sciences University. Welcome, Dr. Bush.
Thank you so much. I'm
Well,
excited to be here.
It's not, presidents are busy, so it's hard to get them to sit down long enough to do an interview. And so I'm very happy to have you here. She's here for the Arizona Association of Chiropractic's big seminar this weekend in Arizona. And I want to ask a few questions, Dr. Bushway. What's the role of education in the chiropractic profession today?
Yeah, that's such an important question, of course, near and dear to my heart, right? One of the things, I have a fair amount of experience in higher education. One of the things I've learned over the years is that because everybody went to school, they believe they're an expert in education, right? And there's truth in that. But the reality is that people have lots of different expectations about what education in chiropractic ought to be doing. And in my opinion, the role is for us to graduate practice-ready chiropractors according to the standards defined by the profession and the accreditor. So the licensing boards, the accreditors, and us, we come up with standards, and we are holding the bar about what the outcomes are when those people graduate. Now, they're not going to be experts yet, right? They're beginning practitioners, but they're going to be solid, effective practitioners when they graduate.
Now, if I remember correctly, Northwestern Health Sciences University is in the top one or two people when it comes to scores in education and graduation and so forth. Tell me a little bit about that.
Yeah, thank you for asking that. We are always really pleased with that. We believe strongly that higher education has to focus on outcomes for students rather than just inputs. And some of those key outcomes for a student is, can they pass the boards? Can they graduate? And so we believe that once a student joins us, they're one of us, and it's our job to get them to graduation and to pass the boards if they're at all capable. And those are outcomes that we value highly. So yes, we're always number one or number two in both graduation rates and board pass rates for the chiropractic programs across the country.
And that's what a student wants to know. Am I going to pass the boards? I mean, that's the foremost thing in their head.
Right.
The other thing I hear is when they get out, they don't have enough business savvy. And so how is Northwestern, meeting that challenge?
It's a big challenge, right? And we've tried a lot of different ways. And still students will say they didn't tell us anything in school. Well, we know we did. But that's not an answer. If the student's experience is they didn't tell us about a business in school, it doesn't matter if we believe we told them, because we're not telling them in a way that meets their needs. So what we decided to do is we made, with the support actually of NCMIC, we made a set of online modules. We use them throughout their time with us. Every try of those 10 tries, they get different exposure to some part of the business. But then after they graduate, for the first year post-graduation, they have access to all that content for free. And it's online, it's searchable, it's easily accessible, because then is when they want it, right? It's a little bit, sometimes I say it's like, I don't know if you ever saw the Charlie Brown movies, and the teacher would talk, and when Charlie Brown wasn't interested, it would go, wah, 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 wah. And I think we're a little bit like that. Well, we're talking about business when they want to learn how to adjust, right?
That's their primary thing, but then as soon as they get out, unless they go into one of the big things like Chiro One or Joint or something like this, where the business is run by professionals, they have to do it. My wife asked me one day, why do people like medicine? And I said, because they don't have to do anything, go treat patients.
Yeah.
And they don't have to worry about cash flow. They don't have to worry about their bottom line. All they do is, treat patients. And I think that's probably what you're trying to solve there with the online.
It is definitely what we're trying to solve. And the data I saw recently is about 85% of recent grads still go into private practice of some kind. So we still need to help support them.
Well, and the other thing is, there's a lot of practitioners out there that would like to sell their practices.
Yes.
And I finally found a group that's doing it now.
Oh, good.
And that's a very important thing. It's called Sidecar.
Okay.
And they're from South Dakota.
Oh.
And they're right in your neighborhood.
Yeah, they are.
And it's Nathan Unruh and Doug C. And they have a plan. It's called a succession plan. And
That's so great to hear.
so that's something for you to just
I am going to track that.
track it, because the kids come out, they work like for a year with a really established practitioner, and in the process, they get bank financing and everything so they can buy the practice. And
So smart.
and I'm looking at, I had a couple of people in a seminar come up to me here just in this last year and say, "What's my practice worth?" And I said, "Nothing, unless you have a successor."
Yeah.
And I have one friend of mine in Boston, Tom DeVita, worked with me for 40 years. And he was going to give his practice to his son. And I said, "Hold it. You worked hard for this, Tom." So he built the succession program, and he's making the same money for 10 years after he
Awesome.
retired. So
It's a big problem, and I love hearing that because we've been struggling with how can we support our alumni and our students to make those matches, right? And so I love hearing that resource that's doing that because that's exactly what it takes.
yes, both of these guys are field practitioners that have had a lot of experience, and so and both of them have gone through the succession plan themselves.
Yes.
And so they know how it works and what to do and so forth. So
How to make it work.
now, how should the role of the academic programs, the CCE and the NBCE and FCLB interact? That's kind of a politically loaded question.
I'm gonna try to stay above the political intrigue about it, but it is an important question. In my mind, we need those groups to maintain some autonomy because they each have a different role to play in maintaining quality for the profession, right? And by that, what I mean is we educate people, okay? But if we don't have a board exam to validate from an external perspective what
Yep.
students are learning, then we can say they're great, but my standard of great might be really different than another school's standard of great. So we need this external exam. In my mind, it could be more competency-based, and everybody knows that, so that's no secret. But that is part of it. We also need the boards to play a role in understanding what does a good chiropractor look like? What are the key competencies that they need? What are the risks they're seeing when people are out there practicing? So we can educate and try to sort of inoculate against those risks.
You know, I have to say that I was not in favor of everybody flying to Greeley, Colorado to take a board. I'm still not sold, but I think I know why. I mean, they got such different groups and different colleges that they had no standardization. Am I thinking right?
That's what they will say, is that that this was the problem they were solving was standardization. No surprise. I think they could have solved it other ways as well, but I think that the problem of standardization is worthwhile to solve. Yeah.
Yeah, I agree. I heard somebody the other day say at the top we were at about 11,500 students in school, and then it may go down to 9,500 in the next 5 years. Is that what you're hearing, or what's your take on this?
We're definitely hearing something like that. And there has been a decline over the last few years in sort of national enrollment numbers. And it's very hard to know how to predict where that will land, right? And I think there are lots of factors going into that. And one of them is all of our shared role in helping the population, the public, understand how important chiropractic is to our healthcare systems in the country. And I do think we all play a role in that, in making sure that the public and prospective students understand how important this profession is to help maintain the well-being and health of the population.
Well, I think this is where like the VA has helped out a great deal. And I remember, this is some years ago, but I was involved in this because I was here in Arizona and we needed one co-sponsor to have it into the VA.
Oh.
And they said, "Can you fly to Washington, D.C. tomorrow?" And I said, "Sure." So I walked into Senator McCain's office,
Okay.
met by one of his staff, which is normal
Yeah.
for a senator's office. And he said, "Oh, no, the bill is too highly controversial. He's not going to co-sponsor that." And just then McCain walked in. And I said, "Hi, Senator." I said, "I'm Dr. Four, and I'm one of your constituents." And I said, "Would you like to hear a sea story?" Now, there's not a sailor alive that
Yeah.
will not stop and listen to a sea story. He said,
Right.
well, yeah, tell me.
Of course, yeah.
I said, I was on board the USS Alacrity, Mine Division 45, and that's, during
Yeah.
when the time was Cuba, we're having a little problem, and now he's listening.
Yeah.
And I said, we went on Liberty one night and came back, our ships were gone. And we wondered what happened to our house,
Yeah.
And so they said, well, they had to take them out because of a missile attack problem. And so they said, they're going to pick you up in the morning and put you on board. So we were on board that night going down to Cuba. We hit rough weather, and the captain was in the captain's chair, and I saw him just get up to get a cup of coffee, and he slipped and hurt his back. McCain's now really interested.
Yeah.
And he said, well, what happened? And I said, well, we went down to his stateroom, and then he looked at me, he said, "Fool, aren't you a chiropractor?" And I said, yes, sir. He said, then do what chiropractors do. And I gave him an adjustment, and he was on the bridge the next morning. He said, and what was the next morning? I said, we're going into Guantanamo Bay
Oh, my God.
to take the mines out to get the USS Ranger out. He said, so if you hadn't been there to adjust him, he may not have been there for that wonderful mission. I said, that's right, sir. And he said, co-sponsor the bill.
Oh, that's a great story.
And it was all over. He's
That's
that was the last one we needed
What a
to
great
get it
story.
into the VA. So
That's an awesome story. I didn't know that. I
Yeah.
love hearing that story. But the VA has been a leader.
well, and I think that was, and I started then the VA here in Carl T. Hayden Medical Center, and that's the first time I was in integrated practice,
Okay.
which gave me a whole new look. And one day the chief medical officer came in and said, "We got a bit of a problem, Marlon." And I said, "What's that?" He said, "The PTs are on the rage. They don't want you in the building." And he said, "Could you come down and give them a little idea what you do?" So I grabbed a portable table and went down there, about 20 of them.
Mm-hmm.
And I told him who I was, and I said, and I use activator. Anybody ever have an activator adjustment? This guy says in the back, says, "I do. Would you adjust me?"
That's awesome.
Long story short, I said, we're not doing rehab. We're doing spine. We're not even competing with you guys. And
Yeah.
I ended up adjusting 20 of them.
That's awesome.
And the problem was over. We never had another competitive problem in it. And the medical director said, "How did you do that?" I said, "A little bit of demonstration."
Yeah.
So,
Yeah. Yeah.
But long story is, when you get in integrated practice, you really see how valuable chiropractic is. So
Yeah. We believe that's firmly at Northwestern. We're really big advocates of whole person care or integrative care.
yes,
Pardon me.
it sounds like chiropractic education is similar to how all higher education needs to make some significant changes. How can that be done?
Yeah, there are a lot of changes that need to get done in higher ed and in Chiro in particular. I mean, if you think about it, over time, things have to change and adjust. We were just talking about how work is more often remote now than it used to be before. And those same changes happen in higher education. And one of the things for chiropractic education is it's really rooted still. And I'm going to say 80 years ago or 100 years ago, when it was sort of created and founded as unique institutions that taught chiropractic only. And many people went to school in that way. And that worked. And it was a great model for the time. The problem is the pressures on small institutions right now it's very real. It's very expensive to be an institution of higher education. And there are two primary ways that those programs need to keep innovating. One is the academic model, and the other is, frankly, the business model. And so the academic model, as I've already said to you, has to do with counting hours. So to get licensed in many, many states still, you have to have 42 or 4,400 hours. Hours are a proxy for learning. Hours assume that if you sit by me and my wisdom for long enough, you'll become wise as well. And honestly, people learn in different ways. It might take me 10 hours to learn what you can get in 2 hours. And we ought not make you sit for the other 8 hours and be bored and tedious. We ought to assess that you've got the competency and move on to the next one. So that's what I mean by focus on outcomes versus inputs. That's a huge shift when you've got everything from an accrediting board to a licensing board to, even the testing board looking at hours people spend rather than what they've learned. So that shift we're working on really hard. The business model shift is a little more disruptive. Well, maybe they're both so disruptive. I don't know. But we came from a model where the chiropractic programs funded the institutions. And it was okay to keep raising the tuition for a period of time. Inflation that the schools have to deal with is way bigger, and you can't scale the costs with a small program in the same way you can with a large institution. You know what it means to scale a business. It's hard to do with a very small program. So you see some growth in some of the programs, but as I said earlier, growth has to be done the right way, that people can still succeed in it. So there's going to be things like affiliations and partnerships and maybe joining systems, other models to deliver these chiropractic programs that we're going to see happening. Many people right now think in higher ed, like mergers are the academic or the business model innovation for right now. How do we get that done while we maintain the spirit, if that's the right thing, the spirit and the essence of a good chiropractic program? So,
And I talked to a lot of college presidents.
yes.
And I'm thinking of John Scringe right now,
Yeah.
who's probably one of the leaders in bringing other things into the campus.
Yeah.
But he told me, he said, you have to be very careful
You do.
because, if you're coming in like a PA program, you probably should have $5 million in the bank in about 5 years to be able to handle this. And they didn't do it correctly at Logan. I mean, I've been close to that.
Yeah.
And it was a problem because they put too much money, too many people, and they're going to be lucky to even keep that program going. And so
It's expensive. It's expensive. I'm going to tell you, we just announced this, so I'm a little nervous to tell you, but I'm going to tell you, we have just announced a new affiliation with a program in Minneapolis called the Minneapolis School of Nurse and Anesthesiology. And so they need an affiliation to do their degree granting. And they've been in existence 80 years. They are also top, 100% of their students in the last 3 years have passed their boards. So top outcomes. And so we are affiliating with them to do their degree granting, and we will get revenue from that, and they will continue to benefit from it. And they're coming to us because they love the idea of integrative care, because they love being on a health sciences campus, and they've been at one of the state universities, and they're very excited about joining us. So
I think there are ways to solve these things. It's just like having the first 2 or 3 years online.
yes,
And if I remember correctly, you came from,
I did.
was it Camperville or what do you?
I came from Capella.
Capella, I'm sorry. That's what it
all
was,
right.
is Capella. And you knew online long before the people were into it in chiropractic. But don't you think things are online today? I mean,
Yeah.
in our own business, virtual training has gone online.
Yeah, you guys have. Yeah.
And we have 1,000 doctors every year that take virtual training, and it's the way they do it now to get their license renewed. And they actually learn, they say, better because they can sit in their office and do it a little piece at a time. And so we're bundling it now so you can take different parts.
Smart. I mean, my opinion is that, of course, you can't teach everything about activator or chiropractic in the online environment, but the didactic part you can teach better in the online, and then you can use the face-to-face time to get the top of what you need from a interpersonal.
I told you that we have 150 papers and 30 clinical
That's
trials.
amazing.
Well, one of our papers was testing online versus a manual in New Zealand, and they tried it with hands-on and then with online, and actually found the online was slightly superior to hands-on because people look at it closely, go back and review it, where in a seminar they couldn't even get near to the table to see what the guy was doing and so forth. So I think there's some value both ways.
Both ways. And some people don't like the online. Well, then we have to have options for them as well.
Well, we're coming to Northwestern Health Sciences
Yeah.
University in October for a
excited.
live seminar, and we're really looking forward to that. And I think some of the value of a live seminar is camaraderie.
Yes.
And, they all get together, eat together, and drink together. And, but they learn from each other, and they're doing the same kind of thing. And so they really build themselves up. And so that's why we have big attendance for those. So we'll look
That's
forward
true.
to that this fall.
No, we're excited you're coming. And it's true. It's still hard to replicate the whole in-person experience in the online environment. That's why, we do a lot of hybrid work. So our main lectures are actually delivered what we call flex. So you can come in person to the lecture. We record it so you can view it later, so you can learn again, like you said, or we live stream it. So if for some reason you can't be there, you're not well, whatever it is, you can still watch it.
See, that's repetition, and I had a friend of mine one time said you have to have repetition for learning.
You do.
It's just part of how the body
right.
and the mind works. So,
Yeah.
well, I think you sound like you're on top of it.
Well, I don't know about that. Maybe a good day.
And I really appreciate you being here in the podcast today.
Oh,
and
thank you.
We're going to put this out to a lot of people. We're making some real progress in our podcast, and so everybody's having a look to see what people's opinions are on a lot of things. So,
Well, it's an honor to be here. I appreciate you having me. So,
well, thank you, Dr. Bushway,
Thank
the
you.
president of National Health Sciences University in Minneapolis. Well, Richfield, I guess it is, isn't it?
Bloomington.
Bloomington. I was
Close, right next
I
to
was close.
Richfield, yeah.
Being an old Minnesotan, I'm off a bit because I haven't been there for 30 years.
Right.
But,
You'll be there soon.
yeah, we'll be there soon. So thank you very much.
All right. Thank you.
Thanks for listening to Activate Your Practice podcast. Remember, this is brought to you by SoftTech Table Company. You can find more information on this table at softtechtables.com.
SoftTech manufactures specialized treatment tables designed to help chiropractors who utilize the activator method maximize their time and the success of their procedures. Upgrade to the only adjusting tables endorsed by activator methods at softtechtables.com.